Good morning. Good morning. My name is Ruth Hoffman, and I am a Medicare benefits specialist here at Storen Financial. And we're going to be covering information on the basics of Medicare. And also, if you are already on Medicare, I can certainly address some of the questions you might have. If you could tell me if you can see our PowerPoint, you can communicate with us and let us know if that's coming across well, that'd be great. I have a number of slides we'll be going through, so let's get started. Okay, so as I mentioned, our goal here at Storen Financial is to also help our clients that may be coming onto Medicare to better understand what their options are. Or if you're already on Medicare and you have a question that you would like to have someone address, I'm here to help you. You can feel free to call the Storen number, which is 317-852-7000, or you can email me at ruth@storenfinancial.com. So I'm here to help, and it would be my pleasure. I've been in this arena for over 15 years, started back in 2006, and my primary focus is the senior market. I focus on marketing Medicare supplement plans, Advantage plans, and the prescription drug plan, which is called the Part D. Whenever you schedule an appointment with me, or if you reach out to me either by phone or by email, rest assured that there is no cost for my recommendations or our visit together. I'm here to help you better understand what you're currently on, if you're leaving an employer plan and coming on to Medicare, making sure that you move to the plan that's going to meet your needs when it comes to healthcare and prescription drug plans. It's important, just like with a financial visit here at Storen, to understand what your consequences are going to be once you come on to Medicare. So this presentation is called Get to Know Medicare, or what we typically call Medicare Made Clear. These are some of the topics that we're going to cover. I'm going to touch on, what's Medicare? Do I need Medicare if I'm still working? How do I choose? All of these will be addressed as I'm going through the PowerPoint. So what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes you pay while you're working, and it's an individual insurance. This is not like your employer plan where it covers a family. Medicare is not free. It is not a family health plan. It is not Social Security, and it's not Medicaid. So who can get Medicare? Well, U.S. citizens and legal residents. Legal residents must have lived in the United States for at least 5 years prior to applying for Medicare. Typically, it's for individuals 65 and older. However, there are younger individuals with qualifying disabilities that are granted Medicare. For example, if you've got end-stage renal disease or a debilitating illness like Parkinson's or Lou Gehrig's disease. I apologize for flipping back and forth. This is a question I get quite a bit. If I'm currently working, is it necessary for me to enroll in Medicare? And generally, if you work for an employer that has more than 20 employees and their health coverage is considered credible, it's not necessary for you to enroll in Medicare. What you need to evaluate is, is my current health plan covering the needs that I have? And looking at the deductibles, one thing. So certainly there is no need for you to move on to Medicare if you're still working past age 65. Now, if your employer has fewer than 20 employees, and the coverage is not considered credible, then you would have to enroll into Medicare. What if I'm covered under my spouse's employer plan? There also, if it's a large employer, you don't have to leave your spouse's health insurance plan to come onto Medicare, and you may very well want to stay on that as it may have richer benefits than coming onto Medicare. So getting Medicare while still working, if your employer requires you to pick up Medicare, then Medicare and your employer plan will coordinate. One will pay first and the other one will pay second. If you come onto Medicare, you will no longer be able to contribute to your health savings account, your HSA. That's the biggest downside to coming onto Medicare if you are still working and contributing to an HSA. Medicare will not cover anyone but you, so consider how your dependents are covered under your employer plan. What does Medicare cover? So original Medicare has two parts. It's Part A and Part B. And at a very high level, Part A is hospital insurance and Part B is medical insurance. Anytime you're walking in and walking out for services, that's going to be covered under the Part B. So what are some of the things that are covered under Part A? So if you're admitted into the hospital, it's going to cover your room and your meals, care in special units like intensive care, any of the prescriptions and medical supplies that are provided to you as an inpatient, any tests or labs or x-rays, operating room, recovery, skilled nursing services, if you get a blood transfusion, hospice care, part-time skilled care for homebound after a qualified inpatient stay, and rehabilitation. So those are the things that are covered under Part A. So Part A, just quickly to share with you, you have been paying for this benefit all of your working life. So if you've paid taxes for 10 years or longer, then this Part A comes to you at no additional cost. You can't be denied coverage. Coverage is nationwide, including any qualifying hospitals in the United States. Coverage and cost are per benefit period, and I'll touch on that. You must be admitted as an inpatient in order for the benefit to be covered under Part A. There is a tendency sometimes for folks to be admitted into the hospital, but only be under an observation status. And you need to know if that's the case because it's going to affect your benefits. And Part A also provides 60 lifetime reserve days that you can utilize. For Part B, again, it's anytime you're using services on an outpatient basis, for example, doctor office visits, labs and x-rays, physical therapy, occupational therapy, durable medical equipment's covered under the Part B. Diabetic screening, some of the preventative benefits are covered under Part B. Ambulatory surgical services are covered under this category as well. Emergency room ambulance. So that is the Part B. So fast facts, when you enroll in Medicare, when you enroll in Part B, you will have a monthly premium that's going to be adjusted for your income. You can't be denied coverage. Coverage is nationwide, including any provider who accepts Medicare. And there are premium penalties for late enrollment if you fail to enroll when it's your time to come on to Medicare with Part B. Now, for example, if you're still working and you work past age 65, and then let's say you decide to retire at 68, you're going to be granted what's called a special election period to bring the Part B in place without a penalty. So Medicare doesn't cover everything. It's good insurance, but there are gaps. So all of the costs of your care, you have out-of-pocket costs without limits. Prescription drugs at the retail level is not covered under Medicare. Routine dental, vision, and hearing. Long-term care for custodial care is not covered. Excess charges that some doctors will charge the patient if you see them. and care received outside of the United States except for certain circumstances. So I will tell you, if you're on original Medicare or any health plan, once you come onto Medicare and you travel outside of the United States, be aware that you have limited coverage, and you may want to consider purchasing a health insurance plan for the duration of your trip. The few $100s that you spent will save you hundreds of thousands of dollars if you have a medical emergency outside of the United States. So where can I get more coverage, or what are my options? Again, in order to have option 1 and option 2, you must have Medicare Part A and Part B. Both of those must be in place. So if we look on the left-hand side under option 1, you add one or both of the following to original Medicare. So when it comes to your health benefits, Medicare under option number 1 will pay first. And then if we look at the lower part of the graph, you're going to see a Medicare supplement plan or a Medigap policy. And those are put in place because there are gaps that are going to be your responsibility when you use services under Medicare A and B that the Medigap policy will help cover, like deductibles and coinsurances. And then for prescription drug coverage or for the Part D, you have to put a prescription plan in place so that you can have benefits when you go to your retail pharmacy. The other option you have is to consider a Medicare Advantage plan, or what's called a Part C. And those are offered by private insurance companies. And these private insurance companies have contracts with Medicare. And so they stand in place of Medicare so that the providers are going to file with the Advantage plan for A, services, B, they deliver prescription benefits, and they offer additional benefits like vision, dental, fitness membership, and other things. So these are the two options. You either are under option number 1 with original Medicare, or you allow the private insurance company to stand in place of Medicare under the Medicare Advantage plan to deliver services for A, B, and D. So a Medicare Advantage plan is another way for you to receive your Medicare benefits. It's an alternative to original Medicare. It's not that you lose your Medicare. Medicare, with the contracts they have with private insurance companies, compensates the private insurance company on a monthly basis to be responsible for delivering your benefits under A and B. So the member must still be enrolled in Medicare Part A and Part B, and you will continue to pay your Part B premium. Typically that comes out of your Social Security check, or you're going to pay that directly to Social Security. Benefits are administered by the plan. Plans are offered by private insurance companies. Most plans offer built-in drug coverage, but there are some Advantage plans that will deliver only benefits under A and B. For example, if you're a veteran and you get your prescriptions at the VA, you may not need to have a Part D component to your Advantage plan. And again, the upside to Advantage plans is that they offer you some of the additional benefits you've been accustomed to, like dental, vision, and so you want to give that some consideration. So Part C, or what's called the Medicare Advantage plan, offers all of the benefits of original Medicare under Part A and Part B. And most plans include prescription. They offer additional benefits like I've mentioned, and you see those on the right-hand side there. So just to mention, there are a number of different Medicare Advantage plans. And if you look on the left-hand side and the right side, you're going to see that there's an HMO, or what's called a health maintenance organization plan. There's a preferred provider plan. There are special needs plans for individuals that have chronic conditions or also receive benefits from the state under Medicaid. And then there's other types that are called private fee-for-service and medical savings account plans. So there's a lot of choices. So fast facts. Again, in order to be eligible for a Medicare Advantage plan, you must be enrolled in Medicare Part A and Part B, and you have to live in the service area. These plans are typically tied to the county and the state in which that you live in. They do cover you nationwide, so no need to be concerned on that. Coverage cannot be denied based on your current financial or health status, including pre-existing. It may require you to use certain providers and pharmacies. It is a network type of environment, but many of these plans are well networked in your particular area. Coverage and costs vary by plans and may change each year. And annual limits of out-of-pocket costs for covered services. So with an Advantage plan, there's a term called maximum out-of-pocket. And each time that you put money out of your pocket for services for A, which is hospitalization, or B, which is doctor visit outpatient services, whether you're in network or out of network, it goes towards that maximum out of pocket. So there's a limit to your financial exposure through the Advantage plan, which is a big plus for the consumer. And then you must continue to pay your Part B premium. That's a requirement. So let's talk about prescription drug plans. And there's two ways that you can receive prescription drug benefits. You can have a standalone drug plan, or it can be included in your Medicare Advantage plan. So typically under the prescription drug benefit, Medicare Part Ds will cover the most common prescribed drugs that Medicare beneficiaries typically are taking on a daily basis. Specific brand name drugs and generic drugs are on a list that is called a formulary. If you enroll in a standalone drug plan or you're on an Advantage plan, typically you are given a formulary so that you can review that and see how are my drugs going to be covered. Commercially available vaccines not covered under Part B will be covered under the Part D. So be aware of that. The prescription drug program has what's called a formulary tier. You see it goes from 1 to 5. And the cost of the medication as you move from 1 to 5 is reflective of medications being more expensive. So it's important to know, are most of my drugs under tier 1s or tier 2, or are they more down to tier 3 and tier 4? And the reason you want to know that is because you have a fixed benefit on an annual basis for prescription coverage. And how you spend that benefit is going to determine how quickly you're going to get into what's called the gap or the donut hole. And that's a term that I'll touch on momentarily. So what happens is on a calendar year basis, whether you have a standalone drug plan or it's embedded in your Medicare Advantage plan, you move from left to right. So there's an annual deductible, and I'm going to share with you what those numbers are for 2022 in case you want to write these down. So most drug plans, standalone, and even some Advantage plans, there's an annual deductible for next year of $480. And typically that has to be paid for medications like tier 4 and tier 5. The initial benefit is moving up to $4,430. And then the gap amount or the donut hole number is moving up to $7,050. And these are adjusted on an annual basis on a calendar year. So what happens is as we're filling our prescriptions, you may have to pay the deductible first if you are on higher tier medications, or you go right into the initial coverage category. And as you're filling your prescriptions, that initial coverage amount, that $4,430, is going to be hit by the total cost of the drug. So be aware of that. And we'll have some examples here. Okay, and these benefits are put in place January 1st through December 31st. If you don't utilize your entire initial coverage amount, then it does not roll over into the next year. Oops, there's someone wanting to be admitted. Okay, so again, for Part D, you must be enrolled in Medicare A, B, or both to pick up a prescription benefit. You must use pharmacies that are networked with the plan that you're on. That's where you're going to get the best cost point on your medication. Coverage and costs vary by plan and may change every year. And the Part D premium has a penalty if you have a late enrollment. So again, if you don't pick up a drug plan when you're first eligible for Medicare, unless you're still working or have coverage through your spouse's employer plan, and then you decide to pick up a Part D, whether it's standalone or part of an Advantage plan, Medicare is going to ask, why did you not pick up this Part D when you first became eligible? And then they're going to assess you a late enrollment penalty, which is 1% of the average cost of a standard drug plan across the United States for every month you were not on it. Okay, so let's talk about option number one. Several slides back, we talked about how there's two sides to the coin. We talked about Medicare supplement insurance, or a Medigap policy. And this helps pay some of the out-of-pocket costs not covered under Part A and Part B. And these are sold by private insurance company. So they cannot be used in conjunction with a Medicare Advantage plan. You're either on side one or you're on side two. There are 10 standard plans under the Medicare or Medigap environment, and they're standardized and are regulated by the state. Plans are labeled by letters like Plan A, G, and costs vary and services are covered by varying plans. So therefore, doesn't matter if you're in Wisconsin or you're in Maine, a Plan G is a Plan G because they deliver the same benefits. So the plan helps pay, for example, under Part A, if you're hospitalized, Medicare covers everything but a in-hospital deductible. And right now for this calendar year, that's somewhere in the range of about $1,400. So whether you're there 1 day or 15 days, Medicare is going to cover everything but a $1,400 deductible. So if you have a supplement plan in place, then that deductible will be picked up for that monthly premium you're paying. Under Part A, it also covers skilled nursing facility care and the co-insurances if it's for rehabilitation. This is not for long-term care. Part B also has co-insurances and co-pays. There's the first 3 pints of blood transfusion are not covered by Medicare, but the supplement will cover that. The supplement also provides you 365 extra hospital days. So that gives you protection of exposure because Medicare is not that rich. Hospice is covered by Medicare, so there could be some costs associated with it. That is covered by the Medigap policy. There are deductibles for Part B and Part A for that matter that are covered under the supplement program. You get some limited coverage for foreign travel. I still would highly recommend you pick up health insurance for the duration of your trip because the limits are not very rich, and provides coverage above Medicare approved amounts. So if an individual, you go see a specialist and they want to exercise their right for that 15% above and beyond what Medicare pays, the Medicare supplement plan will pick that up. Now, on the right-hand side, what does it not cover? Medicare and a Medicare supplement plan do not cover prescription drug plans at the retail level. Doesn't provide dental, vision, or hearing, custodial care like for bathing, eating, dressing, and long-term care is not a benefit you get through the supplement program or Medicare. A Medicare supplement plan, again, you must be enrolled in Medicare Part A and Part B, and you have to live in the state in which the plan is offered. There's no medical underwriting when you come on to a supplement 6 months after enrolling in Part B at age 65 or older. There's nationwide coverage. There's no network to be concerned about. It's guaranteed renewable as long as you pay your premium. Plan premiums may vary for the same coverage. So for example, if you buy a supplement plan in California versus the state of Indiana, there's going to be a difference in the amount the premium is because healthcare costs vary from one state to another. And you must continue to pay your Part B premium when enrolled under a Medicare supplement plan. So how much does Medicare cost? So for premiums, there's a fixed amount that you pay for coverage, usually monthly. So when you enroll on to Medicare Part A and Part B, A, you've been paying for all of your working life, and B, depending on your income level, will determine the premium. But the average premium right now for Part B is about $148.50 per month. There are deductibles that you would be required to pay. That's why it's important, if you stay under original Medicare, to pick up a supplement. You have co-pays and co-insurances that would be your responsibility. If you don't put a Medigap policy or supplement plan in place and you're on original Medicare, there is no limit to your financial exposure for that calendar year. If you utilize a lot of services, that could be expensive. So Part C, D, and the Medigap policy. You might want to take a quick picture of this, or take some notes, but it kind of gives you an overview of what are the differences. So with a with a Medicare Advantage plan, there are plans out there that will come to you at no additional cost on the premium side on a monthly basis. You will have deductibles, co-insurance, and co-pays for services up to a limit, and that limit is called a maximum out of pocket, which is at the bottom of the screen here. For prescription drugs, again, you pay a monthly premium, and that monthly premium is going to deliver you the $4,430 worth of total drug benefit. When you go to the pharmacy, depending on what tier the drug is, you'll have an inexpensive copay or a high copay. And tier 5 typically is for medications that have a co-insurance, or you pay a percentage. A Medicare supplement plan or a Medigap policy, you're going to have an additional monthly premium. And for certain plans, you will have deductibles and co-insurances that are your responsibility. So how do I choose? So again, the first step is enrolling at original Medicare. And that means making sure you have that red, white, and blue card on the far left there with Part A and Part B. And then you're going to consider option number 1 or option number 2. And it all comes down to, I think a couple of things. Under option number 1, if you don't want to be restricted in regards to a network, if you want to be able to obtain benefits, let's say anywhere across the United States, then that's the way to go. Of course, putting a Medigap policy in place is going to be more expensive, but it does give you that flexibility in regards to being able to utilize services without worrying about a network. Then you have to add your prescription Part D in order to have prescription benefits at the retail level. If you're a person perhaps that utilizes services on occasion, you're fairly healthy, working in a network is not a concern for you, then option number 2 is the way to go. It provides benefits under A and B, just like original Medicare, and it also delivers the prescription drug benefit. And then you get those additional services that original Medicare does not provide. For example, like vision and dental, a fitness membership, hearing aid benefits. So, you want to consider between a Medigap and a Medicare Advantage plan. So under the coverage side, it pays some costs not paid by original Medicare. You pay that monthly premium, whether you use the plan or not. Doesn't help with drug costs. You do get the nationwide coverage, and it may offer some additional added value services. Cost is going to be higher than being on a Medicare Advantage plan because you're paying a monthly premium. You have to add drugs because that's not covered under original Medicare. And the convenience is that when you add it will coordinate with original Medicare, and then you have to have a Part D standalone. Under the Advantage plan, it provides all the benefits and then some that original Medicare offers. It includes prescription drug coverage. It typically has a network tied with it. It may offer additional health benefits like dental, vision, and hearing. You may or may not have a charge for the plan. Often, no additional premium for drug coverage. You will have copays and co-insurances to a limit, which is called an annual out-of-pocket maximum. And it's an all-in-one plan. So when you're on a Medicare Advantage plan and you go to the doctor, the hospital, the pharmacy, you're showing your Medicare Advantage card. When you're with original Medicare and a Medigap policy plan, when you go for healthcare services, you're showing your Medicare and your Medigap card. When you go to the pharmacy, you would show your standalone drug card. So when can I enroll? Well, for those folks that are just coming on to Medicare, there's what's called an initial enrollment period. It's 3 months before, the month of, and 3 months after that you can make a request through Social Security to add your Part B. Once you have A and B in place, you have these 7 months in which to apply for Medicare. Once you have those in place, then you can make a selection for a Medicare Advantage plan, a prescription drug plan, or a Medigap policy. So I would advise, if you're going to be separating from an employer or will be losing benefits from an employer plan when you turn 65, make sure you're keeping in mind these 7 months. You don't want to have gaps in coverage or late enrollment penalties. So be aware of that. There's a general enrollment period for folks maybe that didn't put the Part A or B in place. That is between January through June. This is when you can make a request from Social Security and you can enroll in Part A, Part B, or both. And then once those enrollments are made, then you can choose between a Medicare Advantage plan or a standalone prescription drug plan, or even consider putting a Medigap policy in place under option number 1. During the general enrollment period, if the enrollment was not done in a timely fashion, you can expect to have what's called a late enrollment premium penalty that's going to be applied. The Medicare Supplement open enrollment period. When it comes to coming on to Medicare, this is why if you're on an employer plan, you may want to delay putting your Part B in place. It's because of the 6 months we're showing here. Once Part B goes into effect, then you have a 6-month window in which you can apply for a Medicare supplement plan or a Medigap policy with no medical underwriting. So if that's important to you, you want to delay that Part B until you absolutely need to have it so that you can guarantee and protect this 6-month window. So because there's no medical underwriting and you cannot be denied or charge higher premiums for your Medigap policy. There are special enrollment periods and it's an 8-month window. This is, for example, for those that delay putting their Part B in place because they're still working, and then you separate from an employer. You have an 8-month window in which to reach out to Social Security to put your Part B in place. I would tell you to do it in a timely fashion so that there are no lapse in coverage, and be aware that once you lose employer coverage in regards to a standalone prescription drug plan or an Advantage plan that includes prescription, you only have 63 days in which to put that in place. Otherwise, you're going to have a penalty for delaying that. So there can be late enrollment periods for Part A, Part B, and Part D. So be aware, work with a broker that understands the consequences of delaying your enrollment in any of these 3 services or plans, so that you're not going to be one of those individuals that will be hit with a late enrollment penalty. Once the late enrollment penalty is assessed by Medicare, it's pretty much there for the duration of the time that you're enrolled in Medicare Part A and Part B or Part D. When can I change my coverage? Well, right now we're in what's called the annual enrollment period or the open enrollment period. It starts October the 15th through December the 7th. So this is the time for individuals that are already on Medicare with Part A and Part B to look at switching. You can drop a Medicare Advantage plan or a prescription drug plan. You can return back to original Medicare if you choose to do that, or you can pick up a different Advantage plan. You can also, at this time, return back to original Medicare and look to see about putting a Medicare supplement plan or a Medigap policy in place. So be aware, October 15th through December 7th is a sensitive time, and you need to do this on a timely basis. Once December 7th comes and goes, there is what's called a Medicare Advantage open enrollment period. That would only be for individuals that have a Medicare Advantage plan as of the end of December 31st. So what that will allow you to do is to switch to a different Advantage plan or return back to original Medicare at a supplement and a drug plan. And it just allows you to have one change. Special enrollment periods for qualifying life events. And those typically happen for 2 months after that qualifying event. For example, if you've been in a nursing home or you made a move from Florida to Indiana, you have 2 months in which to meet with a broker or call your existing plan and make sure they're aware that you've moved to a different state, different county, and that they need to put a plan in place that is going to meet the needs you have in your new location. So how can I save money? I would recommend that you utilize preventative services. Those are offered both by Medicare and Advantage plan. Use your plan network. If you're on a Medicare Advantage plan and it's tied to a network, those individuals that are part of the network will deliver services at a reduced cost than those that are out of network. On the prescription side, have a conversation with your providers and ask them, is there a generic or a low tier prescription drug plan, drug that will deliver the same benefit at a lower cost. Make sure you utilize in-network pharmacies for prescriptions, and mail order is a big plus. And again, understand your status in the hospital. Am I an admitted patient or am I being observed? Because that will affect your benefits should you have to go to a long-term care facility for rehabilitation, especially if you're under original Medicare with a Medigap policy. There's places you can reach out to if you feel that you have a financial need. There's some individuals that will get extra help with their prescription drug cost under the Extra Help program. If you qualify for Medicaid, Medicare Savings Program. So your local state SHIP office, you see the number listed here, is a great resource to call if you feel that you fall into any of those categories. So where can I go for help? Of course, United Healthcare has a website that's called MedicareMadeClear.com, which kind of goes along with this presentation. You can go to Facebook, YouTube. More importantly, their Medicare.gov is an excellent resource. I don't know if you've been there yet or not, but it's a place you want to visit, especially now with new plan information from next year for 2022 has been loaded. So if you want to see how your medication is going to be covered, let's say under a standalone prescription drug plan, you can do that now. You can also reach out to Medicare. They have customer service reps there that will answer your questions. And if you're wanting to enroll in Medicare Part A and Part B, that starts at the Social Security level. So you can go to socialsecurity.gov or you can call them and they will help you start the process. So I want to thank you for joining us this morning and getting a broad overview of Medicare and what is involved with that. If you have any questions or would like to schedule a one-on-one, give the office the call. Again, that number is 317-852-7000, or you can reach me by email at ruth@storenfinancial.com. So I want to thank you for joining us, and I'm here to assist you. Our meeting would come to you at no cost. So don't hesitate to give me a call, and I'm here to answer your questions as best I can. Thank you and have a great day.